Good morning. I think I have about 5 minutes to go through about 50 slides. We'll do it quick. Actually, the slides do speak for themselves, so it's a very visual presentation. So I think we'll just begin. Go ahead. Just to remind you of why we're here, that's the purpose of the summit, and particularly the objective 3. Really what I'm asked to do is I'm sort of the setup man for what's coming, the discussion that's coming. So this is background information for what we'll be talking about during the facilitated session. Okay. You know, the old adage that's true in real estate is also true, as Dr. Eichen said, in public health. It's all about location. That health problems are geographically distributed because of those social determinants of health that he talked about. And yes, we do have the same kind of clear patterns in Cuyahoga County that they do in Alameda, and that's what these slides are going to show you. Let's just look at poverty rates. You can see in Cuyahoga County, the darkest areas are those with the highest poverty. The dark black border is the city of Cleveland. So you can see where the poverty, those are broken down by census tracts, where the highest poverty rates are concentrated. Go ahead. You look at race, the dots. I tried to change the color of the dots so you could see them better, but it didn't work out. On the right, the yellow dots, that's the African American community, and on the west side, the sort of light green, those are Latino. So you can see it's overlaid over the poverty data. Again, just shows the concentration of race. African Americans typically live in eastern parts of the city and the county. Education. This slide simply shows the percent of births that occurred to girls and women that did not have a high school diploma. Again, the darkest areas are those with the highest rates. Okay. Housing conditions. Good. You see a pattern already emerging? It's the same sorts of colors. The darkest colors on the map show the highest concentration of housing units that, according to the auditor, have below average or in below average condition. This one is foreclosure filings. This is fairly recent. Between 2006 and June of this year, the concentration of the dots shows where the most foreclosures have occurred. And then the County Planning Commission did a very interesting analysis of food deserts, and I wanted to show some of their slides, and I appreciate their efforts here. There was a study done in Chicago that was really looking at how access to food markets and fast food, how does that affect health? And defining a food desert as an area where with no or a distant grocery store, you have to travel quite a distance. Go ahead. So they concluded in the Chicago study that living in a food desert can mean greater rates of obesity, premature death, lower quality of life, especially for mothers and children, and that it's clear that food deserts, especially those with an abundance of fast food options, pose serious health and wellness challenges to the residents who live there. So our County Planning Commission did an interesting study, and those boxes, the little squares, kind of the gold squares, are grocery stores greater than 25,000 square feet, so a large size grocery store. And then they show the distances, and you can see that table up in the middle top there, that in the city of Cleveland, you've got to go further to get to one of those than you do in the suburbs. They're just trying to show how accessible they are to the population. And then here, all those dots are the fast food establishments that are throughout the county, and the distances there. You can see where some of those are concentrated along major thoroughfares. And then here was an analysis they did to show, you can't read that, in fact I can't read it, but I will get closer to read it. What they showed was that, maybe you could focus that a little bit, because I think this is very interesting. What you want is a 1, a value of 1, because it shows the best distribution of fast food versus the ratio between fast food and grocery stores. Well, as you see in the top there, the city of Cleveland food balance score is 4.5, or more than twice what the suburbs are. And so what that says is people have more access to fast food restaurants, less access to grocery stores. They have to travel further to get to those places, the grocery stores where they have fresh fruits and vegetables, and travel less far to get to fast food restaurants that have foods that are less healthy. And again, you can see the concentration is pretty much along the same lines as some of the other data. Go ahead. This one shows households without vehicles, because it's just sort of driving that point home that if you don't have a car, it's even harder to get to those grocery stores and access to those fresh produce. So I think if you hit it one more time, it's sort of, yeah. And that shows that in those particular neighborhoods, again, those high concentrated poverty neighborhoods, there's less access to vehicles and therefore harder to get to those grocery stores. These slides also came from the Planning Commission. Just since this is a land use summit, just the change in the development over the years. This was the developed land 1948 to 2002, and then if you hit the slide again, this is the change. So you can see a pretty dramatic change. We don't have a lot of green space left. We do have some. And then another slide. This, the guy who sent me this slide, Dan from your office, he said, I just threw this in because it's cool. And it's an infrared photograph. And what he did was he took this slide and he created the next one, which shows the natural land cover. And so you get a sense of where the development has occurred, where there's very little natural land cover left. And it's primarily in the city, as you would expect. Okay. So the point of all those slides is that, as Dr. Iden said, land use, resource distribution, all those sorts of things, they do affect health outcomes. They go through different paths. They affect access to food, people's ability to become physically active. They affect poverty, housing conditions, all sorts of things like that, that ultimately contribute to poor health outcomes. And this was just another slide that shows the lead. I guess this is the percentage of lead, what is it, elevated blood levels within Cuyahoga County. And again, you can see that it's primarily within the city.